the topic today is hip abductors, and the first thing we're going to do is talk about passive range of motion. The muscles involved will be your gluteus medius and gluteus minimus, and the plane of motion it will be in is your frontal plane. So if you drew a line straight down the front, it would separate front to back. So what I'm going to do is I'm going to have the patient in a supine position on their back, and I'm going to make sure to go ahead and stabilize right here approximately and right here under the leg to make sure they don't go into any external rotation. And I'm going to go ahead and bring them out until I feel that point that they're not going to go anymore. Come back in, and I'm going to do that about 5 to 10 times. Okay. All right, so the next thing we're going to do is the joint mobilization to be able to help with our hip abduction. So I'm going to do a hip long axis traction. I'm going to be performing a grade 3 manipulation for that general mobility. The patient needs to be in a starting position of their hip in 30 degrees of flexion, abduction, and a little bit of external rotation. My hands as a therapist are going to be right here above the ankle, and I'm going to be pulling through the long axis of the bone. So I'm going to make sure I have good biomechanics. I'm going to get up here on the table, and I'm going to be doing the grade 3, so that means I'm going to be going through large amplitudes, and I'm going to be going through the whole motion and into the resistance. And I'm going to be doing those oscillations 1 to 2 times per second for a minute. And we're going to do that for about 3 to 5 cycles. Good. All right, so the next thing we're going to do is stretching, and to increase our hip abduction, I'm going to be stretching our adductors. So that will be your gracilis, your adductor longus, magnus, and brevis. So the first thing I'm going to do is show you how I would stretch it as the therapist. So the patient is going to be again in a supine position, and I'm going to again stabilize here underneath the proximal leg and here right underneath the knee. And I'm going to make sure and ask the patient to tell me when they feel a slight but tolerable stretch right here on the inside of your leg, okay? So I'm going to go ahead and bring you out. You feel it? Okay, so now that she feels that, I'm going to hold that for about 30 to 60 seconds, and then we're going to do that about 2 to 3 times, okay? I'm not going to stay here for the whole 30 seconds, but just for reference, 30 to 60 seconds to hold this. Okay. So next I'm going to go ahead and teach the patient how to do this at home on their own for stretching. So we're going to use this strap right here, and what we're going to do is place that strap right around the foot right here, and then she's going to have the other end in her hand. And all we're going to do is tell her to bring that leg out to the side with that strap until she feels that point of a slight but tolerable stretch. And then once again, you're going to hold that for 30 to 60 seconds, and try to do this as many times in the day as you can tolerate, but at least 2 to 3 times per week, okay? Alright, so the next thing we're going to do is a resistance exercise to be able to strengthen our hip abductors. So again, that gluteus minimus and medius. So we're going to be using a resistance band here. So at home, she can go ahead and tie this around a table, a chair, any kind of stationary object. And what we want to do is place this band on the outside leg. So if this is the table over here, it's going to be on the outside leg. And she wants to start in a position where she does feel a little bit of tension, just so we have that resistance throughout the whole range of motion. And what we're going to do is take this leg straight out to the side. Good, and back in. Try to keep that torso upright, okay? Good, and out and in. Perfect. And if they need stabilization, they can kind of use that hand on the side if need be. And then if she were to do the other side, she would just turn around and then put the band on the opposite leg. All right, so we're going to do that for 8 to 12 reps, and you're going to do that for 2 to 4 sets, making sure we have that 2 to 3 minute rest in between those sets, and then 4 to 8 hours rest in between those sessions, and we're going to do that 2 to 3 days per week.